All right, so before we get going, I'd like to acknowledge the traditional owners of the land that we're on. So for the HCCA office, we're in Ngunnawal and Ngambri land. And if you're from outside the ACT, do pop where you are in the chat. I'd like to pay my respects to their elders past and present and acknowledge their continuing contribution to the culture of this city and this region, and acknowledge that sovereignty was never ceded and this always was and always will be Aboriginal land. Today, we are going to be talking about finding good health information online, and this is the sort of order we'll be going in. I'll start off with why we need trusted information and what makes a good source of health information, just so we're all on the same page to start with. And then we'll throw to Brooke, who's going to talk to us about social media and misinformation, some really awesome research she's done. And if we've got time, we'll have some questions, some examples, and we'll share a few more resources as well. Of course, since this will all be recorded, it will end up on the HCCA YouTube and you'll get an email afterwards with more resources. Okay. So to start off with, why is it important to find good health information? Well, it's all part of being an informed consumer, which is a really important part of having good health literacy and participating in your healthcare, because healthcare shouldn't just happen to you, you should be part of it. So it's really important to learn a bit about your health and health conditions. And of course, you can learn about that from your doctor, but you might want to get some more information about how do other people live with the conditions that I have, or what are some other treatments or things that I can do to support myself. And sometimes online resources are really helpful. Doing that research, of course, helps you ask better questions about what's going on, and particularly where things may have worked for other people that you hadn't heard of before or haven't tried. But you need to know if that information is trustworthy and it's right for you, so that you don't do something without appropriate medical advice or potentially do something dangerous if that information is wrong. And whilst I'll be talking a lot about being cautious of online health information here, I don't want to discourage you from seeking out more information online because it can really help you uh, take a bit of control over your health and participate in your healthcare. So some of the risks of bad health information are actual injuries and illnesses. So for example, I know there was a bit of a spate of people using some online remedies to try and remove moles and potential cancers from their faces using a kind of herbal remedy a few years ago. And a lot of those people ended up with really significant burns and injuries because of what was in that particular mix. And that was all spread online. So it causes some real harm to people if they're not careful. It could be overdiagnosis in that you're going and seeking a diagnosis for something that you might not actually have. It could be that you are kind of influenced by other people to think that you have something that's a more serious than it really is. Um, it could be something like taking the wrong medication or dose. So we've all seen the ivermectin stuff that came out through COVID, but I've even seen people sort of being advised online that, oh, you could take a little bit more of this medicine you're already on, and that's fine. But that can be really, really risky, even if lots of people are saying it. Um, it could be refusing or delaying healthcare. So we see that a lot with things like vaccines, but I've also seen examples of it with things like chemotherapy, where people are kind of putting off more serious healthcare because they want to try another remedy first. So we've got to be a bit careful about that too. Spreading contagious illness is a big one. It could be around not getting vaccinated or people certainly telling you that certain measures like masking aren't as helpful as they really are, according to the evidence. And it could just be stress. You could read something online that makes you think you've got something really serious, and that adds a lot of emotional turmoil. So stress is a factor too. And of course, financial costs, because sometimes people are just trying to make money off you. But thankfully, there are strategies to find good sources of information, and I'm going to play you a neat little video from the Commission on Safety and Quality in Healthcare that kind of summarizes the best top tips that we have. So let me know if the sound doesn't come through.
This is how
Oh,
aged
of
care
course, we get
should
an ad.
be. Your own beautiful home with the care you need, delivered with love,
Apologies, folks.
decency, and kindness. Call now to secure it. Amberfield Care Apartments.
Good health information is important and can help you make informed decisions and choices about your health. There's a lot of health information out there. Not all of it is reliable. So how do you know who to trust? Here are our top tips for finding good health information online. 1. Look for information that is relevant to you. Does it answer your questions? Is it Australian? Does it connect you to local services? If yes, these are good signs. 2. Look for trusted sources. If the source is an expert or expert organisation and the information is up to date and based on evidence, it's more likely to be reliable. 3. Is it easy to understand? Good health information is clear and will explain complex concepts in simple ways. 4. Look out for warning signs. If the information is trying to sell you something, make you feel afraid, or only give you one choice or option, it might not be reliable. 5. If you connect with people online, remember that their experiences may not be typical. They may be different to yours and not what happens to most people. 6. Check the information with your healthcare professional. They can help answer questions and explain options. 7. Ask for help. If you're not sure where to start, or you find information you're not sure about, reach out to others. It could be a friend or family member you trust, a health advocate or professional, a librarian, or a local consumer organisation. Ask away. For more information on finding good health information online, visit our website.
All right. So I'm going to go through a few of those sort of principles in a bit more depth, and feel free to pop your own tips in the chat and any questions about them. So the top three are sort of around finding like trusted, relevant, and understandable information. So in terms of trusted information, we're thinking about what is an expert or expert organization? So it could be government departments, peak bodies for a certain condition, research organizations, so universities sometimes. And one of the things you can do is, certainly if you're getting linked things, is double check the URL. So is it a .gov.au or an edu.au or a .org.au? That's usually a good way to look at it. Because those are restricted to certain types of organizations. One thing to say is that there's a lot of .gov sites that are from the US, and some of the information on there has changed in recent years and might not be as reliable as it used to be. So just be a little careful using government information from other countries, particularly given some recent politics. Um, Another thing you can do is look up a health professional's registration. So if you're reading an article, reading a website, and they say Dr. such and such from whatever institution, it could be that you go to the university website and check their academic profile. And I really like doing that to find out, hey, are they actually specialized in the thing they're talking about? Because people can be doctors in a whole range of topics, but they might not be speaking in an area they've got really good expertise. And if they're a registered health professional, so a doctor, a nurse, a midwife, allied health, that sort of thing, you can actually go on the AHPRA website and look them up there and see if they're registered and where they're registered. So that's another way that you can verify that they are the right people. Uh, a word on expert organisations, though, is we have peak bodies for certain conditions in Australia, but some have multiple peak bodies, and sometimes those peak bodies might have certain sponsorships. So it's worth having a look to see, are there multiple ones? And do they have things like product sponsors on their website as well? Because even charities can sometimes have those other interests involved. Another way to look at it is, does it refer to other sources? Can you find those sources? And does it match trusted information? So throughout COVID, there'd be things floating around on radio, in news articles, and it was always a good idea to go and check, well, what's coming up on the government websites and notifications, what's coming up from the health departments. News articles are really great at talking about research projects that have got a lot of potential, but they might not be current and they might not be ready for you to access that treatment. So I like to go and have a look at the research project and kind of see how far along is it. Is it a really early study that we probably won't see actual results of in healthcare in, 5, 10 years? Um, because that way you can sort of find out, hey, is this something that's really relevant to me as well? Checking for sponsors. Even news websites can have sponsored content now. They're supposed to disclose it. So I always look for that little sponsored content tag or see if something's marked editorial rather than reporting. And does it collect your information? This can be a bit of a red flag, but sites that have lots of pop-ups and start asking you to sign up to keep reading, that can be a sign that it might not be the most trustworthy source, or they're just trying to get some traffic out of you. Then we have a look at relevance. So thinking about, does the information in front of you apply to your life? So you might think about your age, the health conditions you have, where you are, your family history and conflicting treatments. So as I've got there, a story about heart attack risk factors for older men might not be helpful for a woman in her mid-20s. And so thinking about those other factors can be really important. And when you're looking at overseas information, that becomes even more important because things might be talked about differently in Australia, certain treatments might not be available, that sort of thing. Is it current and up to date? I'd like to say no more than 5 years old, but it depends on what sort of information you're looking for. If you're looking for really up to date, cutting edge treatments, it's got to be very, very recent. Um, and then is that information relevant to your life? And is it Australian? So, for example, paracetamol is called acetaminophen in the US, and so a lot of people can get confused if they're looking at information across those different countries. And as I've noted there, some information is being changed on certain government websites as well. So it's even more important to know which country it's coming from. And then is that information understandable? So one thing to consider is this information aimed at consumers? Because information that's written for, say, doctors, particularly if it's trying to pitch certain treatments, programs, that sort of thing, it might be written in a very different way. It might contain quite different information. So if it's not aimed at you, there might be something missing. And you might need to seek some more information or context to make sure that it's actually the right stuff for you. Uh, does it use really clear language that you're not confused about? And does it explain any new or like really complex ideas? I like to see if it explains like certain medical terms so that I know what it's referring to and I can double check that information. But another one to do is, can you understand the background information? So it might refer to a scientific paper, and those papers are usually from trusted sources. But if I can't actually understand that information, how do I verify that, say, this news article has interpreted that paper correctly? So that's another thing to think about. Certainly, you might want to double check that before you apply it to your own life. And another thing is that if you're sharing information with someone else and English is not their first language, have a look and see if there's translations. I'll include some links in the mail out afterwards, because context is really important in language, and sometimes it's better to get the fully translated version for people. I'll touch a little bit on warning signs, but Brooke's going to go into a bit more depth on these. But some of my key warning signs are always, is it trying to sell you something? Is it trying to push you into going for a new treatment? Is it offering a miracle or a cure-all? Is it trying to scare you? So is it using really alarmist language so you want to take action now? Because if we take fast action, we're not thinking things through. And is it only giving you one choice or option? There is always more than one choice because we always have the option not to do anything based on that information. So if it's saying there's only one choice, it's definitely a red flag. And is it relying on only one or a few experiences to kind of get you to draw a certain conclusion? And I'm curious, feel free to pop in the chat if you've got any others that you've come across. So I have a few sort of terms that make me go, oh, this might not be reliable. Detox is one of my favorite ones. Or when things are talked about as like balancing, that's kind of a sign that it might be using some wishy-washy language to kind of convince me of something. Yeah, I got some exaggerated claims. Is it wonderful? Is it amazing? That sort of thing. Yeah, absolutely am. Okay. And just a few other tips. Just remember that others' experiences aren't the same as your own. Everyone's lives are a bit different, and you might have a very different reaction to people. Certainly, in my life, I have an autoimmune condition, and that responses to all sorts of things can be very, very different. So I see a lot of misinformation because, hey, this works for me, so it's got to work for everyone else, and that goes around a lot of Facebook groups. Um, Asking for help to find information, judge its quality. As that video mentioned, it could be that you talk to someone trusted, but one that people might not think of is that I like to talk to librarians if I want to go look up a reference for something, because they're a font of useful knowledge about finding good information. And always checking with your health professionals before you make big decisions. And it's checking with them. You are participating in your care, even if doctor sort of says, oh, you've gone to Dr. Google again. That's not really fair. It's okay for you to ask questions based on stuff that you have researched. All right. So I'll stop sharing there and we'll throw over to Brooke to talk about social media.
All right, so thank you so much for inviting me to talk and for everyone for coming along today. I also just very quickly wanted to acknowledge the traditional owners on the land in which I am zooming in from today, the Camaragal people of the Eora Nation, and pay my respects to elders past and present, and extend those respects to any Aboriginal or Torres Strait Islander people on the call today. As C said, this is and always it is or was and always will be um, Aboriginal land. So my talk will cross over a lot of the points that C just covered, which I think are really important. But I just wanted to emphasize that my kind of perspectives are really trying to focus in on the area of social media. And you'll kind of probably be able to see some of the reflections that are coming out based on what we found in our research. So just a really quick background about me. I am a senior research fellow in the School of Public Health at the University of Sydney. And I work across two research groups and organizations. The first one is called the Sydney Health Literacy Lab. And the vision of our lab is to create a healthcare environment where health information is clear, evidence-based, accessible, and actionable for all. We work really closely with consumers and consumer organizations to deliver this and really trying to provide the best, most health literate information so everyone can make decisions based on their values and preferences. I also work in the Wiser Healthcare Research Collaboration, and the mission of this research collaboration, which is a national collaboration that's been going on for a number of years now, is to conduct research that will reduce overdiagnosis and overtreatment in Australia and around the world. And Z talked a little bit about the issue around overdiagnosis, which I'll get into a little tiny bit more throughout my presentation. So, as I'm sure most of you are well aware now that over the last decade or so, social media has emerged really as a space for commercial marketing of various health and medical products directly to consumers. This is done both through traditional advertising, but also through partnering with social media influencers, many of whom have financial or vested interests in discussing what they're discussing. I also think it's quite well known now that misleading information, which includes both mis and disinformation on social media, exists and is quite widespread. In terms of health in particular, following the COVID-19 pandemic, I think we saw a lot coming out from that. And there's now really evidence that up to 87% of social media posts about health are misleading. And the regulation that exists in social media is really, really like the wild, wild west. There's a lot that can be said, a lot that can be done, and it makes it really hard for consumers to be able to navigate the information that's coming out there. It's very persuasive, it's very pervasive, and it's really always at our fingertips in kind of an intimate setting as our phone that's really, up close and personal with us all the time. So it's a really challenging health information environment to navigate for everyone. And for someone like me who has worked in the area of evidence-based healthcare communication, and also being interested in this idea of low-value healthcare, including topics like overdiagnosis and overtreatment, I was really interested to see what was being discussed and promoted on social media around tests, treatments, and other products that really have no evidence of benefit and can potentially lead to harm. And C touched on some of those harms in the previous slide she presented. So I set out with my team of international colleagues to conduct a study where we looked at 5 different medical tests that we knew lacked evidence of benefit for healthy people, or people in the general public who didn't have any underlying medical conditions that related to the tests. And this included full body MRI scans, which was infamously promoted by Kim Kardashian to her hundreds of millions of, or sorry, millions, I shouldn't say hundreds. It actually probably was hundreds of millions of followers a few years ago. Um, we also looked at the multi-cancer early detection blood test, which is a test that claims to test for up to 50 different cancers, but it's really in its infancy in terms of evidence and whether the benefits outweigh the harms. We looked at the anti-Müllerian hormone test, also known as the AMH test or egg timer test, which claims to be a fertility test for women and being promoted to women who aren't even necessarily trying to have a baby. We looked at the gut microbiome test, and we also looked at the testosterone test, which was being largely promoted to young, healthy men. And what we found after looking at 1,000 posts across those 5 different tests that, again, as I said, lack evidence, evidence of overall benefit for healthy consumers, was that they were overwhelmingly misleading in terms of the balance between the discussion around benefits and harms. 87% of them mentioned test benefits, when only less than 14 or less than 15% mentioned potential harms. The overall tone of all the posts was promotional, so really trying to tell you to, buy or take the test. There was very little evidence that was discussed behind these tests, so only 6% included any mention of potential evidence for the tests. Over a third mentioned or had specific anecdotes, personal kind of narratives when discussing the test. 50% directly encouraged the viewer to be tested and get the test. And almost 70% had a clear financial interest. And that was really, we looked at explicit financial interests. So they were directly selling the test. They were giving discounts for it. It was a specific ad. And we actually know on social media that that is probably a vast underrepresentation because lots of financial conflicts of interest or just conflicts of interest more generally tend to be hidden. So I'll just show you there across the 5 different tests what that looked like. So as you can see, the balance between discussion around benefits and harms is quite stark, and overwhelmingly they were promotional. You can also see here the high level of financial interests and the low kind of level of evidence of being used in those posts. And the posts that we saw were really from, the everyday kind of girl next door talking in a very relatable way to her followers about the medical tests. And it also included doctors. 16% of our sample had doctors. And yes, the guy in the far right corner was a medical doctor without a shirt on there. And I'll talk a little bit more about that later. But, there was thousands. Some of these accounts had thousands of followers. Some had millions of followers. So the reach was quite large, and it kind of covered a large array of different types of influencers or account holders. And the really underlying message that we found across the posts that we were seeing about these really kind of medical tests was this idea of knowledge and empowerment through screening and testing. So this idea to kind of live your best life, get on top of your health, optimize your health. And that, as C pointed out before, can be kind of concerning for the everyday consumer just seeing this in the comfort of their own home, where they are then feel like the onus is on them to take control of their health. It really, puts this kind of health equity lens on if you can afford it, you can do it. And there's lots of kind of concerning messages that are around this, and I won't go too much into it, but we really saw this kind of tone being discussed to everyday healthy consumers to just get tested because what could the harm be? And it'll kind of lead you to living this better life when we know the evidence just doesn't support it, especially for these specific tests we looked at. And I'm just going to put a few quotes up there on the screen to kind of show you how, kind of very convincing and kind of the strong emotional appeals and sometimes even fear mongering that was being used there. The first one was about the gut microbiome test saying you deserve to be healthy. It is your birthright. This test will let us know with certainty what is causing your specific health concerns. When in reality, the test just could not do that. So, large claims, really emotive language being used. And so off the back of that study, we noticed particularly through the posts around testosterone testing, that there was this real strong underlying tone around masculinity and sexuality coming out in those posts. And we wanted to delve a little bit deeper into it. And so we took the sample of testosterone posts and we pulled out a subset that really had this kind of these underlying narratives around masculinity and sexuality. And what we found when we looked at them more closely was there was these kind of four overarching principles that were coming out in these posts. That low testosterone was really a crisis that threatened male sexuality. We found this idea of rebranding low testosterone as a young man's issue, linked to this idealization of unrealistic muscular bodies. We found this emphasis on self-optimization and gym performance. And we also found this really narrow promotion around ideals of masculinity. And that was really linked to something that you might have heard in the media around kind of this idea of the manosphere. And that, you're not a real man if you're not engaging with these certain behaviors and taking these certain kind of supplementations to enhance your life and kind of live your best and most successful life. We're also at the moment in the kind of final stages of conducting a very similar study looking at different women's health interventions that we know lack evidence of benefits. These papers are all being written up and submitted at the moment, so I can't share specific results, but I will just say that we've really found similar things than we did in our initial kind of study around the balance between benefits and harms, the concern around financial conflicts of interest, and these really underlying kind of narratives that were being promoted to consumers that weren't based on evidence and used really strong emotional and fear appeals. And these are the different interventions that we looked at in this study. So for women in their 20s, the kind of age group, we looked at boric acid suppositories. We looked at fertility testing for women in their 30s. And then across women kind of 40s to 60s, we looked at different testing, supplementation treatments, and disease prevention of hormone therapies. And all of the things that we looked at, again, lack evidence of benefit for the kind of everyday healthy consumer, but were being directly promoted to those people on various social media outlets. And off the back of these studies, we really wanted to know what interventions did exist to address some of the misleading medical information related to unnecessary medical care and medical overuse. So we conducted this scoping review to try and better understand this. And what we found in the review was that most interventions were targeted at the individual, with only 70% of peer review interventions and 64% of different organizational responses being sensitive to this issue of overuse or overdiagnosis and overtreatment. And I guess just to say that we found that kind of particularly concerning because in the space like social media and the complex environment that exists, it's really hard to kind of get responses that work across these and areas and that are not all, it doesn't place all the onus on the individual. Like I said before, social media is a different ball game. It's all well and good for even people with high health literacy to say they might be able to navigate what's being said on social media, but in reality they can't. I work in this space and I know that after I saw a few dozen of these posts while doing these studies, I was starting to get convinced that I needed these things. The tone that's there, the way they make it relatable, influencers make it relatable to you, the messages they say, and the way it's really clever marketing in most cases. In some cases, there are really good, messages and ways you can connect to some of those stories, but for the large majority of them, it really is just marketing at its core. And so we found it particularly concerning that most interventions were targeting individuals and didn't look at more structural responses that could be addressed. And so this goes to some of the things that C was saying earlier, but kind of things that I just wanted to say that we've seen and what I think of is kind of common and trending on social media that's, kind of marketed more towards the everyday health consumer, or these messages are trying to be target there. And that, these are things like unsupported or non-evidence-based tests, screening and tests and treatments, for example, like we looked at in some of our studies, the kind of anti-vaccination rhetoric that we've probably all seen and heard about. Unregulated supplements and injectables is having a bit of a moment right now. You might have seen a lot around peptides, um, lots and lots of different extreme wellness fads and hacks up there. I see said detox is kind of a word that always sets her or sets them on that kind of path to being alerted that this might be something potentially dodgy. Um, and, even things like there's been a trend around, sunscreen causes cancer and really kind of similar, I guess, similar rhetoric in different spaces for things that we just know have really good evidence and has lots of science to back it. And I guess just to say that there are many, many more. I'm sure you guys have examples. Um, Feel free to pop any in the chat. But I guess also just to say that any health topic can really be discussed misleadingly. It just really depends on who's saying it, what they're saying, and how that context is being delivered. And so these are some of the red flags that I think we need to look out for and what I found from the research that we've done. And the first one really being if it sounds too good to be true, that it probably is. If they're only discussing benefits, there's little or no mention of any harms. That's kind of a big red flag there. If it's not a qualified health professional and some sort of expert in the field or an official health organization, that can be a potential red flag. But I do want to caveat by saying that just because they are a qualified health professional doesn't mean that they don't have a vested interest or a financial interest. Oftentimes, in some of our studies, we were seeing doctors, um, doctors talking about tests and treatments that we knew would lack evidence of benefit, but potentially they could be involved with a company or get kickbacks. Or, as a doctor, if you've been working in a certain field, you tend to believe that a certain treatment or test or something can be potentially more beneficial or needed, and tend to kind of promote that more than need it. So I guess just to say that, these warning signs and red flags can be kind of taken together and used in different contexts. I think this is a really big one and something that C also mentioned, that if there's a clear financial link, so if there's a direct sale, if they're trying to sell you something, or if it's an ad, I think that's a really big red flag to keep an eye out for. If there's no use of evidence and what's being discussed is really only based on a personal narrative or an anecdote, so they're using just a one case study, potentially, and not talking about any kind of the other important caveats for other people. I think that's something just to watch out for. Advising against seeking medical advice or proper healthcare interventions. There's kind of a movement to be more, go natural. And I think, there are probably a lot of good evidence-based kind of natural or preventative healthcare interventions that are being discussed on social media. But when there's a stark shift against the medical establishment, I think that's a pretty big red flag as well. And also using emotive or extreme language or imagery, things like fear mongering, self-optimization, rhetoric. I think it's always good to keep in mind on social media that the more extreme that things that are being said and the more extreme that the videos are, the more viral they become. And influencers know that, and they have a vested interest to make it more extreme so that it does go viral because that builds up their brand, it builds up their clicks and their views, and that's really what the majority of them are out there to get. Here's another resource just to share from our lab that takes together some of the work that myself and colleagues have done and been involved in, and some other resources that we've come across in our work um, about finding good health information online. C had some great examples as well, and I'm definitely really enjoyed that video that was played at the beginning by the Safety and Quality Commission. This is just a bit of new work that's actually coming out in a week or two, where we looked at the impact of social media health information on GPs in Australia. And this was a kind of area that we didn't have a lot of evidence in. I think anecdotally, GPs were saying that they were kind of getting burdened with social media requests or discussions, um, but we didn't really have a lot to go to show that or any good evidence to see what was really being said. And so I guess we did a big cross-sectional study of GPs, almost around 2,000 GPs in Australia. And what we found that patients are being influenced by health information they see on social media, probably unsurprisingly, and discussing this in consultations and presenting with requests based on questionable social media information. You know, I think lots of the things that they said they were seeing lack scientific evidence and really were trying to lead to kind of trying to lead to requests or discussions around unnecessary or unproven interventions. We found that younger GPs were more impacted, probably again unsurprisingly, because they tend to have a younger patient base. Um, but I think the positive news that we found in this study was that GPs feel like they are managing this and that that you can come to them with these discussions. And while this is likely to increase these kind of discussions and the impact on their consultations, I think that they will become more prepared for it. So I just wanted to present that because it is new information that's coming out. And I think just to say that, I think we should be taking what we see online to our GPs, and because they can manage that and have evidence-based discussions about, uh, the things that you're seeing. Some of the other stuff we're trying to do, just as a group, we're really trying to, get these messages out in the public domain. Really trying to, tell the consumers that this does exist. I think, like I said, off the back of COVID, I think that, the public narrative around misinformation is out there, but I think there's a lot of things that people just in the general public aren't aware that, social media influencers or people on there are really trying to do and the tactics that they're using to try and, sell you different health information, or just really trying to call out some of that's happening. We also designed a campaign with the University of Sydney to really try and understand how people engage with evidence-based posts. We put out a suite of posts on full body MRI screening, testosterone testing, and the AMH test. And we tested it in a randomized control trial. Those findings are under review at the moment, so I can't share them. But what we found, I guess, is that, putting good information out there is beneficial for the everyday consumer. And that we, really trying to just understand how we put more of this out, whether it is one of those responses that can be beneficial, or, how do we fight the tide of the information that's out there. We're also, I'll just quickly touch on this, doing a study looking at the regulatory compliance and medical advertising to be able to analyze some of the medical devices that we've seen being promoted and trying to identify patterns, common violations, and different compliance across different regimes internationally. And this is really just to try and, again, tackle some of this or try to create some of these responses to this issue that we're having from a more systemic and regulatory approach. Because, like I said before, I think putting the onus on the consumer alone to navigate all this information is unfair. We need to kind of approach it at multiple levels and with kind of multiple different responses. So just lastly, I guess just to provide again, C presented some really good tips and tricks for how to for what people can do and things to look out for. But this is just kind of some things to reiterate or what I think, particularly from the work that we've done. So I think it's really important for consumers to be skeptical and also be curious. If the health and medical information does sound too good to be true, like I said before, it probably is. But there are also positives to social media and online health seeking. I don't think we need to necessarily avoid it at all costs. I think we just need to go in with a more skeptical or critical lens to it. And this is especially true when there is a clear financial interest involved, like I mentioned before. I think we need to look for balanced discussion around benefits and harms, like I said before, look for credible sources and look for evidence. And don't take things on face value. If you see something once, look into it a bit more. Talk to your doctor about it, talk to your friends about it. Be curious. And really, as I said before, just discuss the benefits of harms of what these different interventions or what you're seeing might mean for you specifically. Because just because it worked for one person doesn't necessarily mean it will work for you. Think about the costs that are involved, what that will mean for you and your family and the wider picture. And like C said, um, you don't always have to do something. The option of doing nothing is always there as well. So that's it from me. I'm happy to take any questions and yeah, any comments as well. Thanks so much.
Any questions from the group, if anyone would like to speak up? I've been keeping an eye on the chat as well. Well, Indra, I could see you've got one in the chat. Do you want to speak to that question?
Yeah, thank you. See, I've been I've been surfing the net as well, and I've seen a lot of social media messaging about vision problems, and some of them going as far as saying, cataracts can be cured completely with whatever they're trying to sell. So, in other words, trying to discourage people from actually going in for surgery and also for macular degeneration. I think they're trying to capture the growing elderly population, the aging population, and some of all the social media. I've actually honed in on one, which I watched, and it was so impressive. It was so impressive. I couldn't believe that it wouldn't be right, but I still had the skeptic in me. So I'm asking Nicole whether you actually do research on particular types of disease groups, or the social media impact on that.
Yeah, so as I showed in the presentation, we've looked across a number of different kind of
Yeah,
inter.
I saw that. Yeah.
Yeah, but we haven't done anything specific to cataracts, but
Yeah, or vision problems, eye
yeah,
problems.
nothing in that realm. But I think the list is endless that we could do research in and look into. I'm not sure of anyone aware of anyone specifically in that space, but I think lots of the elements that we're seeing across a bunch of different tests and treatments and interventions that we looked at are really similar. We're finding really similar themes across a lot of those, and I know
Yeah.
other researchers are as well.
Right. Thank
Thank
you.
you.
And I can see there's a question from Jeff about whether there's been any research into the accuracy of AI related to this.
Yeah, so I have done one study on AI around cancer screening tests. Um, but my colleagues have worked a lot in this space actually. And I guess from my study and from their studies and from what I know in the field, I'm definitely not an expert in that space, is that, AI can give really good health literate sensitive information to consumers, make it easy for them to read in many ways, provide kind of a nice way that the information is presented and broken down for people. But there's lots of hallucinations that exist and errors as well. So, on a whole, lots of it could be good, but there are some really big red flags that have come up across a number of different, conditions and topics that I know have been looked at. I think to say with AI is that um, it's only pulling from what it can find and what it can know. A lot of evidence is behind paywalls, unfortunately, and so it can't get that. And it's just not perfect yet, and I don't know if it it ever really will be. But there are pros and cons to the use of AI for in terms of health. And yeah, my colleague Julie Ayre, she has done a lot of work around this. And I guess we again the same kind of red flags and caution exists when you're trying to navigate that. Don't take it on face value, but potentially it could kind of provide some tips of where to look or what to discuss with a clinician. But yeah, on face value, I think there's some kind of more safe things that you might be able to ask it, but in terms of really health and medical personalized interventions, it just can't and shouldn't do that.
We're hoping to do a session on AI later in the year, folks. So stay tuned for that as well, because it's specifically come up quite a lot.
Mm.
Okay, we'll go to Shoba and Godana, and then we'll sort of wrap things up.
How do
Uh,
you know it's
Oh,
AI?
sorry, Godan, we'll go to Shoba first.
Okay.
Thanks, C. Just a question about psychological effects when you do the biome tests for gut health. Do you think there's any correlation, or does there need to be more research? And
Mm.
what stage is that at? Because I know a lot of people with psychological issues, and their gut biome really needs sorting out. So just wanted your comments on it, please.
Yeah, well, that's again not my specific area of expertise. I'm not a gut microbiologist or anything, but from what we found and why the reason we included it in our study is because the evidence is not there yet for the claims that are being made around what it can do. There is some, like you said, there's some preliminary data and some potential hopeful data that can help with some conditions and things, but it's really just not there yet. And I guess the issue is, yeah, on social media and specific companies are kind of using that kind of glimmer of hope to really sell things that we don't know what they really can do in the long term yet.
And Godana?
How do you know that AI is talking to you or a official website?
Yeah,
That's a
so
very tricky one.
yeah, it is tricky. It's very tricky. Do you want to take that one, see?
I was going to say we'll actually look at addressing that in a bit more depth later in the year because it's getting harder all the time. So I'm going to try and find some experts to come and talk about that specifically.
Thank you.
Yeah.
Okay.
Yeah, but going to the web pages of government organizations or trusted sources that you know directly um, is kind of, I think, still a really good approach.
Thank you.
But Googling now immediately, if you ask a question just into Google, the AI will be the first, that will be the top kind of response there. So you have to kind of sift through, I think. Google is also prioritizing Reddit posts, which I think is a bit concerning. They have some sort of partnership or agreement or something going on there. And Reddit is a form of social media that, again, um, is probably not the most credible source to be drawing on. So yeah, really going through, I think, your list of Google searches to go directly to the web page of the organization is a good tactic.
Okay. So we've got just a few minutes left, and I really want to thank you, Brooke. That's been really interesting, and I'll share everything that we've talked about in the email out. I've just got a few more things to run through. I've gone back and grabbed some other examples from our last presentation, just because I want you to see these as well. Um, so there we go. Just want to show people some other social media ones that came up last year, and these ones are a bit more alarming, but they're as we're going into winter, the flu vaccine one is coming around again. And these ones are just ones that I've observed. So we've got here someone on Twitter claiming to be a nurse manager. No name, no way to look them up, and saying that the flu vaccine it is what killed people. So just be aware that these are also things that are being fed into AI and used on social media quite a lot. So that one's come up. But there's also all these posts that try to look authoritative. And one thing I want to highlight is there are fake citations out there. So if people are trying to cite things on social media, also check that those links are actually real. And it's one of those things that people can use AI to generate real looking links quite a lot. So it just has come up more and more often where people might be trying to make themselves look more legitimate, fake journal articles. Um, And just to say that the flu, there is a lot of evidence that the vaccine is safe and effective, but uh, that's a really common one going around social media again. So keep an eye out for that one. And just to sort of wrap things up, as we've talked about, there's lots you can do with this information. So yes, check with your healthcare professional before making major changes, but doing a bit more research certainly outside social media, because it's very interesting to hear about the GP phenomenon that they're dealing with a lot of social media misinformation and using things to partner in decisions about your healthcare. So really sharing information and listening back and forth. It's not just that your doctor makes all the decisions or you just make all the decisions. It's a really good idea to partner and have that discussion back and forth instead of necessarily going in with, I heard about this on social media. I want to do it. You can also try to proactively manage your health a bit. So it could be learning about more about the tests that are being suggested, so that you can ask better questions rather than just going in with like, I want to get this test because it'll find all these things. We'll use it to inform more of your questions. And you could also do more research into other things that you could do other than taking these really expensive tests. But it's really important to share good information with friends and family as much as possible to try and combat that misinformation. Try not to engage with those posts online that are really misleading, because that, of course, keeps them at the top of people's feeds. I will skip over that video for now. I do want to highlight before we finish up a few trusted websites, and I'll send out a fact sheet with a few more. But Health Direct is sort of my go-to place for any basic health facts, particularly because they've got information partners that are organisations that are verified, have clinical guidelines to make sure the information they share is correct. That includes a lot of those peak bodies for certain conditions, and a lot of information is really practical and about how do you find what you need. So checking out the Health Direct website and their information partners. While we don't have an ACT specific site that's got too much information, Better Health Channel in Victoria is actually really well written, really understandable. The local services might be a little harder to find, but a lot of their stuff is really easy to understand. And likewise, there's one called Your Health Link for New South Wales, but I find the Victorian one is most useful. There's also a site called Health Translations, which has all of these translations from across the country, many different organisations, and a really strict clinical criteria to make sure that all that information is as correct as possible and it's been tested. So if anyone needs translations, it's a great place to go. And nowadays they're even including like Auslan and Easy Read alongside many languages from around the world. And if you want to get into sort of scientific evidence, the Cochrane Library has a lot of systematic reviews of research in healthcare. And one thing I really like about their library is that these systematic reviews have plain language summaries that explain how they weight the evidence, what the quality of the evidence is in really simple terms. So if you're looking for more scientific information, that's a really great place to start, particularly for therapies that the evidence is still kind of emerging for. They can have a lot more information about, well, how good is that evidence and what is actually out there. We've also got all of this information summarised on the Canberra Health Literacy Hub, and I will also say the Sydney Health Literacy Lab link that Brooke shared has a lot of the same sources, including there's one I really love called That's a Claim that teaches you a bunch of critical thinking skills about breaking down, well, is this a sort of logical fallacy? Is this someone trying to trick me in a certain way by phrasing things a certain way? So That's a Claim is really great, and all of that's on the Canberra Health Literacy Hub.